Finding the billing claims address for Blue Cross Blue Shield of Minnesota is the easy part. Mailing the wrong form to it is what gets your addiction treatment claim sent back. BCBSN still takes paper claims, but many addiction treatment forms cannot be mailed at all, and there's a separate address for adjustments and appeals. Here's the claims address lookup workflow for Blue Cross Blue Shield of Minnesota. What to mail, where to mail it, and what has to go through Availity instead. We cover the paper claims address, the separate appeals address, what must route through Availity, and the clinical criteria behind every determination. Blue Cross Blue Shield of Minnesota is the state's largest insurer. More than 1 in 3 Minnesotans carry a plan, so for many programs it's a high-volume payer. BCBSM is one of the earliest Blue Cross affiliates in the country, in operation in the region since the 1930s. The nonprofit affiliate banks over $13 billion in revenue per year, so the volume of addiction treatment activity flowing through it is significant. Many addiction treatment forms can't be submitted by mail at all. Send one to the claims P.O. box and it doesn't get processed. It just costs you days. BCBSM still accepts paper claims, but it is not accepting all utilization management forms by mail. And many clinical forms can't be submitted outside Availity. Send an adjustment or appeal to the claims address instead of the appeals address, and you add avoidable delay to money you're already owed. Behave Health's revenue cycle management service is designed to handle this end-to-end, and unlike general billers, the team only works for behavioral health providers. The RCM team maintains working relationships with every major insurance company in the U.S., so the right address and the right channel are known, not guessed. Because the team specializes in behavioral health, it's designed to know which BCBSM forms route to Availity versus the mail. Before you send a single BCBSM claim, run these 4 steps so the right paperwork goes to the right place the first time. Skip 1 and the claim comes back or stalls. Let's walk through all 4. Step 1. Confirm the form can actually be mailed. Many behavioral health and addiction treatment forms on the BCBSM site cannot be submitted outside the Availity system. Check before you print. Standard paper claims are still accepted by mail. It's the utilization management and clinical forms that aren't. Step 2. For a mailable claim, use the Document Processing Center claims address. Blue Cross and Blue Shield of Minnesota, Document Processing Center, P.O. Box 982805, El Paso, Texas. Step 3. Adjustments and appeals go to a different P.O. box. Don't reuse the claims address. For a provider adjustment or appeal, use Document Processing Center, P.O. Box 982800. 1 digit different, and it matters. Step 4. Send prior authorizations through the Availity provider portal, not the mail. As of 2019, BCBSM stopped accepting prior authorization requests by fax or phone in favor of an all-Availity system. All prior authorization requests now must be submitted through the Availity provider portal. The EDI clearinghouse BCBSM adopted. BCBSM's coverage and medical necessity determinations don't come from one standard set. They're synthesized in-house, which makes them more subjective than objective. The Blue Cross Medical and Behavioral Health Policy Committee combines several criteria sets and decides in-house. The committee draws from EviCore Healthcare clinical guidelines, federal employees programs medical policies, and interqual criteria. Because no single standardized set governs, determinations are more subjective. Know the benchmarks before you submit. Behave Health's RCM service is designed to cover every component of addiction treatment billing, so finding the right address and channel isn't your team's problem. The service covers verification of benefits and utilization review on the front end of the claim. It also handles billing and collections and patient responsibility through the cycle. And it manages denials and appeals, including knowing which BCBSM channel each one belongs in. Stop hunting for the right BCBSM claims address and channel. Book a 20-minute demo of Behavioral Health RCM at behavehealth.com. See verification, utilization review, billing and denials handled by a behavioral health-only team at behavehealth.com.